Okay, so we'll be moving on towards the focus review of benchmarking. And today, in today's session, okay, we'll go through and try to understand what benchmarking in healthcare is, what it is, and how we use it, what are the different types. Okay, and then after that, we'll go through HCAP survey um, and see how it actually helps in patient experience measurement and also in the reimbursement and all. And in next session, we'll be dealing with clinical pathway, clinical practice guidelines and clinical pathways, along with reviewing the professional practices like peer review, credentialing, and privileging. So for today, we will stick to 1 and 2, and the other half will be dealing in the next session. Okay. Now, coming to benchmarking, what is benchmarking? So, as per the definition of benchmarking is concerned, it's a structured process for comparing organizational work practices to the best similar practices. So it's comparing organizational work practices to the best similar practices, not just any random practice, but the best comparable ones. So in a way, like it's like looking at the other side of the fence and looking at the best performance, whether it may be inside the organization or outside the organization, and asking like what are they doing differently that we can learn something from them. Okay, in a way, like for example, you may start comparing your hospital acquired infection rate, maybe surgical site infection rate, to some of the top performing hospital, or you are going to compare your emergencies door to needle time in stroke patients with the national benchmark, with the best hospitals over there. Okay, you are comparing with the best performers. Okay, so remember, one important thing is benchmarking is not about blaming or shaming. The golden thing is it's about learning. Okay, it's in a systemic way of saying like if someone's doing better than me, okay, let me know, let us know, let us see, let us understand how they are doing it, and we'll try to adapt in our context. Okay, so that's the thing about benchmarking. Here you are going to compare with someone who is performing better than you, with the aim of learning from them, to see how they are differently doing from us. What are the things that you are supposed to implement in your own context to improve your processes, your outcomes? Okay. Now, for benchmarking to be meaningful, we need data and we need good comparators. Okay. So, who does this? In a way, like generally coming to the benchmarking data. Okay, most of the times it's a for-profit database companies that provide benchmarking data for healthcare organizations. Okay, so many hospitals actually they subscribe to external benchmarking services and databases that may include organizations aggregate performance data, patient safety indicators, or patient satisfaction score, financial metrics, whatever it may be. They generally take help of for-profit organizations. Okay, apart from for-profit organizations, also there are certain registration national databases from where you can actually benchmark your things. Okay, but remember this important thing: for comparison to be fair, we need to adjust for risk. We all know this. In previous session also, we saw how we use, I mean, like how important it is for us to monitor standardized mortality rate rather than raw mortality rate, right? So in similar way, we are supposed to adjust the risk and then use the data. Okay, collected data should be analyzed using similar risk adjustment factors for fair comparisons. Okay, risk adjustment means accounting for differences in patient population, so that we are actually comparing apples to apples. not apples to oranges, right? So we have already discussed such risk adjustment thing in our previous chapter. Okay, so in a way, like risk adjustment uses the statistical methods to include the factors like age, severity of illness, comorbidities, and other clinical risk factors, so that the performance comparison reflect the context and quality. Okay, now there are two types of benchmarking: internal benchmarking and external benchmarking. Internal benchmarking is like it identifies best practices within an organization. It compares departments or units to improve overall performance. So internal benchmarking is within a hospital, right? Within a hospital, if one ward is consistently low rates of medication errors or low hospital acquired infections, whereas other wards are actually struggling. Okay, in such scenario, with internal benchmarking, you are going to compare your sort of indicators throughout the organization across these wards. All right, you are going to compare these indicators. You are trying to identify high performing ward and then study its processes, what they are actually doing different. Okay, so in case of medication errors, if at all one ward is performing well and the others are lagging behind, you are going to see how they are actually handling their medication, how they are actually doing their medication reconciliation, or how they are actually labeling their high alert medications, how are they educating their own team. Okay, all these things actually can be learned and can be spread to other wards, right? So that's more about internal benchmarking. And in internal benchmarking, data is actually easier to use, easier to get, easier to obtain, because the context is similar. You follow same policies, you have same hardware and IT systems, similar patient populations sometimes. Okay, and also the most important thing is there is less resistance, because you are learning from your own organization, your own success stories, right? That's about internal benchmarking. Now coming to external benchmarking. External benchmarking involves using the comparative data from other organizations. So it utilizes comparative data from other organizations, allows for broader perspective and industry-wide comparisons. Here, you might compare your hospital's sepsis mortality rate against the national averages from your national database or from the top performers around your region. Okay, or you might be looking into the HCAPS communication scores when you compare it to other hospitals within your region or within your country, right? So this external benchmarking actually helps you to see whether you are actually doing average, above average, or below average, whatever it is. And if certain organizations are doing better than you, okay, what can you learn from them, right? So remember, both these two types, internal and external benchmarking, are actually needed for a good quality program, right? So this internal benchmarking drives improvement within the organization, and external will tell you where you actually stand in the wider sort of healthcare scenario, right? Now, so we know about benchmarking now. So let's see how actually to do it. Okay, remember benchmarking again, like any other quality initiative we have spoken till now, it's a journey, it's not a one time event, and it has certain steps. Okay, now step one, decide what to benchmark. Okay, this is very obvious, but most of the times organizations actually fail here. They want to do everything at once, but no, you can't benchmark everything at once. You need to be specific. You need to pick something specific, whether a process, an outcome, or a metric. I mean, like whether that may be surgical site infection or your medication reconciliation process or whatever it may be. You should be more focused at this stage. Okay, the more you focused, then more useful this benchmarking is. You can't say you can't actually vaguely or in broad terms say I want to compare my HAI rate completely. No, in HAI decide what you want to benchmark, whether SSI, whether COTI, whether VAP, or whether CLAPSI. Okay, be specific in this. Now, in step two, understand your current performance. Before you look at anyone else, you need to know exactly where you are, right? Exactly. See your data, analyze your process, map it out, because this is very much important. You cannot identify a gap if you don't know where your own baseline is, right? Identify that gap. I mean, like, see where you are today and where the best performers are. And closing that gap is what we are looking into in this whole exercise, right? So try to understand your current performance, identify that particular gap. And then in step three, you plan. You plan your study. What are you going to benchmark against? How will you collect the data? Who's on your team? What's your timeline, right? So, I mean, like, after planning, move to step four, where you are going to study others, right? So you are now looking at high performers. You're asking how did they do it? What are they actually doing? What does their process look like? What are they doing differently from what I'm doing, right? So I mean, like, by looking at others, this is not spying or copying. It's more about learning. There's a reason. I mean, right? So, for example, you see, in most of the quality initiatives, we told that Toyota's production model does this, does that, and all, right? So, Toyota inspired us to adapt in our healthcare context and has actually transformed healthcare quality also. We have studied those processes, we have adapted them, we have improved, right? Now, coming to the next step, learn from the data. So we all know data without interpretation is just a noise, right? Here, we sit down and see what we have gathered and see what does this data tell me, what are the patterns, and how can we actually adapt this. Okay, so see, not every top performers, not everything what they do, what the top performers do will actually work in your context, right? Sometimes they will, sometimes they won't, right? It's your job to find out what actually works in your context. Because see, there may be some benchmarking wherein they may be having a excellent tertiary critical care team, right, in that hospital. If they are able to manage certain cases very much effectively with least standardized mortality rate, if at all your hospital, your organization is somewhere far away from the center, without proper facilities, or if you don't have the excellent critical care and you are only a primary care center, okay, if the similar number of similar cases do come to your center and to their center, your mortality rate may be higher when compared to them, right? So certain things which they certain protocols which they adopt from because of the resources available there, you can't exactly copy them to your context. It's your job to see what you can actually look into, what you actually can adapt. Okay, so learn from the data. And then the final step is using the findings and acting, right? This is the step which is very much important, because you are supposed to take your findings, you implement changes, you monitor, you adjust, and you do it. Okay, by that you actually finish off one cycle of the benchmarking. Now, before we move ahead, one golden rule of benchmarking is this particular statement: key to effective benchmarking is to be sure you are comparing the same processes in both organizations. Same processes, not similar ones, the same. Like, for example, if your hospital's 30-day readmission rate is somewhere around 15%, and there's another hospital in another city where they have their 30-day readmission rate to somewhere around 10%. Okay, if you look at them and say, oh, they are performing way better than us, and then you directly start off the improvement project. But throughout the during that process, you realize that they have been only counting elective admissions, and you are counting all the admissions. All right. So were you actually comparing the same thing? No. So that's not benchmarking, because you see, you are supposed to compare everything, compare the same thing. Okay. So always try to validate whether, I mean, like what you and the benchmarking partner are defining, measuring, collecting data. Is it about the exact same process or not? Before you actually come to any sort of conclusion. This is one of the golden rule of benchmarking. You are supposed to compare the same processes in both organizations, not the similar ones. You have to define things. You have to measure the same way. You have to collect the data in the same way. Only then you will come across the proper benchmarking things. Okay. Now, coming to Xerox 10-step benchmarking methodology. See, Xerox invented the modern benchmarking process. Xerox is an American organization, American company, which actually manufactures copiers. We all know that. Okay. So, in a way, like they were getting crushed by the Japanese competitors, Canon and other organizations, who are actually selling copiers at prices far lower than what it is costing Xerox to manufacture actually. So, to the rate which the competitors are selling the copiers, Xerox could not actually manufacture the unit at all, right? So in a way, like Xerox had to find out how that is even possible, right? And what they need to learn, from whom they are supposed to learn, and how to close that gap. That's very much important. That's where Xerox has come up with this benchmarking process, learning from the best to become the best actually. Okay. And we all know now Xerox survived and they have won the National Balraj Award for quality. Okay, remember this. So Xerox has come up with a 10-step model. It is organized in 4 phases: plan, analyze, integrate, and then act. Okay. So the steps are very much familiar. In first step, you are supposed to identify the benchmarking subject and team. Like we all know, what exactly are we trying to improve? Patient wait times, medication turnaround time, whatever it may be. Be specific. It should be like it should not be vague, right? So that's one thing. We need to select what the benchmarking is about, and also we are supposed to assemble the right team for benchmarking. Now in step 2, identify and select benchmarking partners. Here you are supposed to see who does better than you, right? So, and one thing to remember is you are not just looking into something in your own industry. For example, I mean, like your benchmarking partner doesn't have to be healthcare itself. For example, Toyota has pioneered just-in-time supply chain management. Okay, we have brought in our inventory management just-in-time thing from Toyota, and airlines actually developed what do you say, crew resource communication protocols, right? We are supposed to look into them as far as the communication, and then WHO patient safety checklist. All this do come up from the other industries. Okay, so we are looking for best in class. Okay, now coming to step 3, identify method and collect data. Again, different ways of collecting data, whether that may be surveys, interviews, published documents, whatever it is, you are supposed to collect the data. But the data should be valid, comparable, and actionable. Okay. Now, coming to phase 2 of analysis, determine current competitive gap. So you take your current performance data and then you are supposed to compare where you are when compared to the competition. Okay, that gap, that's the main purpose. That's the gap we are going to close up. Now, project future performance levels. So here in this particular step, we are going to think ahead. See, your benchmarking partner will continue to improve, right? So don't just aim for where they are today. Project where they will be in 2 to 3 years and aim for that particular level. This is future thinking. So, for example, like, see, if you are in a running race, if you want to catch up to the runner who is running first, running ahead of everyone, you don't just look at where he is now and run to that particular place. You will see where he is running to, and your aim will be to go there. Right? In similar way, when you are comparing yourself to your peer or to the other organization, don't look at where they are now in that particular process. Look at where they will be in 2 to 3 years of time and target that particular thing. Think future, right? Now, coming to step 6, communicate findings and gain acceptance. Okay. Now, you have done the analysis, you have the data. Sorry, it was my kid. So, coming to step 6, communicate findings and gain acceptance. Now, see, um, data alone does not change behavior. You have to tell the story of the data. Present your findings to your leadership, to the physicians, to nurses, to whoever that particular thing affects, right? In a way that is clear and non-threatening in a way. So here you're supposed to say, look, he has an opportunity we haven't fully utilized. Okay. You never threaten like you are failing compared to XYZ or something like that. Frame it as a possibility. No blame game involved. Communication is very much important. Try to gain the acceptance. If you frame it properly, you will try to gain the acceptance from your fellow colleagues or the frontline workers as well as for your leadership. Then after that, establish functional improvement goals. Here, your thing is to have functional goal. The benchmark should be the benchmark gap should be specific, measurable, attainable, actionable, right? Time bound, everything. See, for example, it should be like reducing door to balloon time from 78 minutes or 80 minutes to 60 minutes within 12 months. The smart goals we have already discussed. Establish those smart goals here in this step. And finally, coming to the action phase, in step 8, develop an action plan. Okay, build your own roadmap. Who does what, when, and all. This is more of a project charter in Six Sigma project. Okay, develop that action plan. Step 9, implement plans and monitor progress. Yes. Execution, monitoring. You implement the change, watch it closely, use the run charts, control charts, whatever it is, and then continuously monitor. In case if intervention is needed, intervene, correct the course. Finally, step 10, recalibrate and reset benchmark levels. Once you have achieved the benchmark, you raise the bar. You are supposed to recalibrate. You are supposed to reset. Aim for much higher level. Okay, this is a continuous improvement process. You don't just do it once and leave it there. You are supposed to improve from the baseline. Before you have benchmarked against one organization, that's your baseline. And then you have achieved that benchmark. And then that benchmark becomes the baseline and you are supposed to target a little higher. This is how this Xerox 10-step benchmarking methodology runs. Okay. Now, here we are going to compare creativity and innovation. Okay. So what is creativity? What is innovation? Creativity means it's an act of creating new ideas, imaginations, and possibilities. See, it's talking about ideas, imaginations, possibilities, because it lives in the mind. It's about thinking something new. Okay. Coming to innovation, innovation is the introduction of something new and effective into the market. See, introduction. Innovation has to leave the building, it has to actually reach the real world. Okay. Creativity lives in the mind. Innovation leaves the mind, leaves the room, leaves the building, reaches the market. Right? When we compare the process, creativity is imaginative, whereas innovation is productive. Imagination is free. You can dream up ideas while showering, in a meeting, on a flight. Even in today's class, you can actually start imagining things. There are no rules, no resources needed, just your mind, right? That's creativity. Innovation, productivity. The process for innovation is productivity. That requires structure, systems, resources, team, right? When you move from creativity to innovation, you're actually shifting from dreaming to actually doing things, right? From just about planning here, talking here, imagining yourself in your mind, to actually implementing that in the world. Okay. Now, as far as quantifiable things is concerned, creativity is not quantifiable and innovation is quantifiable. Say, you can't measure creativity directly, right? How do you put, you can't put a number to your idea. You can't say, like, okay, this team has generated 47 units of creativity today. No, it's intangible. You can't quantify. But innovation, you can quantify absolutely. You can count how many new processes were implemented, or you can measure the impact of those processes, whether reduction in HAIs, improvement in HCAP scores, whatever it is, right? That's quantifiable. Now, creativity is related to thinking something new, and innovation is introducing something new. Okay. Now, money consumption, so creativity is free, right? It doesn't cost you money. The brain doesn't send you any sort of invoice for thinking, whereas innovation is does require money. Okay, innovation costs money. Okay, for any sort of new protocol, it costs the staff their time. Implementing new EHR, that requires training, that requires certain infrastructure, that costs money. Okay, that's the reason why leadership buy-in is very much important as far as healthcare quality is concerned. Okay, you can walk into a meeting, you can have a very brilliant creative idea, but that idea actually needs a business case. That idea should have a cost benefit analysis, and you should have an implementation plan. Only then, along with good communication, only then you are going to get the funding for that particular idea, right? That's where creativity comes out as innovation and practical implementation. Okay. Now, coming to risk, creativity has no risk at all, right? You can think of n number of wild ideas, nothing bad happens. But the moment you introduce something new, something practical, then you are taking a risk. Whether that will work, whether staff adopt to it, or will it cause any sort of unintended consequences, whatever it may be. The risk will always be there. Okay. So that's the summary of creativity and innovation. Okay. Now, coming to HCAP's survey overview, HCAPS means the Hospital Consumers Assessment of Healthcare Provider System. Okay, so the definition for HCAPS is it is a standardized patient satisfaction survey required by CMS for all United States hospitals. Okay, it's a standardized patient satisfaction, more accurately, patient experience survey. Okay, this is required by all US hospitals, Medicare, Medicaid services centers for all hospitals that actually participate in Medicare project. Okay, so this talks about patient experience rather than satisfaction, because HCAPS actually focuses on specific aspects of hospital stay, the communication with nurses and doctors, responsiveness, cleanliness, quietness, pain control, discharge information. Okay, this doesn't just talk about patient, whether the patient liked the hospital overall or not. It talks about different domains, different aspects of the hospital stay. Now, this survey is administered to adult inpatients. Remember, this is administered to all adult inpatients excluding psychiatric patients for obvious reasons. Okay, remember this particular thing. All adult patients excluding psychiatric patients. Okay. And when this when is this HCAP survey conducted? It is conducted shortly after discharge by phone from 48 hours to 6 weeks after discharge. Because see, patients should be contacted within this window to ensure that their experience is still relatively fresh, but not so immediate. Not immediately after discharge, not at the time of discharge, so that they are overwhelmed or still in crisis. Okay. Because if you see, you will be tempted. If at all you have given, if you have provided excellent service in your organization, you will be tempted to take that sort of HCAP survey at the time of discharge itself. By in case if you believe that you did a brilliant job and the patient is also very much satisfied with what things how things have happened, even though there was some minor inconveniences in certain processes, the patient will be more tending towards giving you a more positive sort of ratings and feedbacks at the time of discharge, because he's fresh off some good experiences, forgetting some minor inconveniences and all. But in case if you have contacted them after 48 hours and within 6 weeks, by the time he goes home, that overwhelming feeling of good things will a little bit dry down and will be more realistic in his answers. He will be able to communicate more realistically, thinking from every angle as to how he felt, how his experience was in different domains and aspects, of course. And here he will also talk about the good things as well as some minor inconveniences which he has faced. That's the reason why the timing is very much important. This is anywhere between 48 hours to 6 weeks. This is one of the exam questions, probable exam questions as well for you. Okay. So remember, this is a standard and publicly reported system, HCAPS in United States. This is required as mandate by Center for Medicare and Medicaid for all organizations within the US who actually have that Medicare system. Okay. And it is administered to all adult inpatients, excluding psychiatric patients. These are the things which you should remember. Now, now see, in HCAPS, okay, what are the things what why this HCAPS is important? Okay, so it captures patient voice. Okay, it provides you the insights into patient perception of care, like how did that particular nurse behave with them, was the communication proper or not? Okay, so how actually the doctor responded to their queries, or how the discharge counseling was done. Okay, and whether they felt safe, whether how was the quietness within the wards. Okay, so all these things will be captured over here from the patient's perspective. Okay, this is about the perceptive dimension of quality. Okay, we'll get into insights of these things. And because this particular HCAPS is publicly reported online and the results of all these things are displayed online via CMS, there is definitely an impact to the reputation of an organization. Because if you do well, obviously that's a great thing, right? In case, for example, if there's any sort of patient who is willing to undergo an elective surgery, obviously he'll go online, he'll check for organizations who have good HCAP score, and obviously he'll choose one with the better scores, right? So here, this HCAPS actually has an impact on the reputation of organizations. If HCAP score is low, obviously that is going to impact negatively for the organization. That's why this HCAPS is important. This is important for us to know the patient voice, and also because it has an impact on reputation. Obviously, there is financial implication as well, because the government reimbursement is based on survey results. See, if at all if at all an organization is continuously doing bad as far as HCAP score is concerned, when compared to the national benchmarks or the levels, the reimbursement by the payer from the government is going to cut down, because obviously if someone is going better, he is supposed to be incentivized, and if someone is not doing better and if they are performing worse, obviously they are supposed to be punished, and that is done through reimbursement. If someone's doing excellently, they will be incentivized, more reimbursement. If someone's not doing well, then there will be cut or punishment as far as reimbursement is concerned. So there's a financial impact on the organization as well. So that's why HCAPS is very much important. Now, what are there in HCAPS survey? What are the questions that are there? See, these are the three important domains as far as HCAP survey is concerned. The first one is obviously the communication, right? So this evaluates doctors and nurse communication skills and the respect they have given. So how often did nurse explain things in a way they can understand, or how often did doctors listen to them carefully, right? So how did the staff treat, whether it was it with courtesy and respect or not. Okay, so in a way, like these are all the things as far as communication is concerned will be evaluated. Okay, and see, there's a strong correlation between the overall hospital rating and these communication scores are concerned. Okay, if the communication is good, obviously the overall rating is also good in most of the cases, right? Now, they'll also assess the hospital environment. They'll assess the cleanliness and quietness of the hospital as well. Like how often the rooms and bathrooms were kept clean, was the room quiet at night or not, and all these things. Okay, that may sound basic, but they are the things which actually significantly shape patients' perception as far as safety, respect, and comfort is concerned, right? Now, the another domain is care management. It covers pain management, medication communication, and discharge information. Like how was the pain? Was it well controlled or not? Okay. How did the staff explain the medication related things? How was the communication in that aspect? Or at the time of discharge, was everything counseled? Right? Did they talk about any sort of help that the patient might need at home or not? Okay, all these questions do help, right? So, how effectively the patients were educated as far as their care is concerned. That tries to evaluate the overall care management, right? So, these are the top three domains as far as HCAP survey is concerned. But in short, remember HCAP survey is used in United States by CMS as mandated by CMS by all United States organizations. Okay. And the most important things in this particular thing for you to remember is these things. How does this impact an organizations? Because it captures patient's voice. It has an impact on reputation as well as on the financial things of the organization. And these are the things that you should be remembering. Most importantly, who actually who actually gives this survey, all adult inpatients excluding psychiatric patients, and the timing from 48 hours to 6 weeks after discharge. Okay, with that we'll finish off we have finished off the two things as far as benchmarking and HCAP survey is concerned, and in next session we'll be discussing regarding clinical pathways, guidelines, as well as the other things. Okay.